Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. The nurse's initial priority when managing a physically assaultive client is to 1. Restrict the client to the room. 2. Place the client under one-to-one supervision. 3. Restore the client's self-control and prevent further loss of control. 4. Clear the immediate area of other clients to prevent harm. The correct answer is 3. Most important priority in the nursing management of an assaultive client is to maintain milieu safety by restoring the client's self-control. A quick assessment of situation, psychological intervention, chemical intervention, and possibly physical control are important when managing the physically assaultive client. The nurse observes a LPN/LVN perform a wet to dry dressing change on a 2-inch abdominal incision. Which of the following behaviors, if performed by the LPN/LVN, would indicate an understanding of proper technique? 1. A clean cotton ball is used to cleanse from the top of the incision to the bottom of the incision using long strokes. 2. The incision is packed with sterile gauze, and then sterile saline is poured over the dressing. 3. The nurse packs wet gauze into the incision without overlapping it onto the skin. 4. The old dressing is saturated with sterile saline before it is removed. The correct answer is 3. If wet dressing touches skin, it could cause skin breakdown. The nurse assesses the development of a 3-month-old boy in the Well Baby Clinic. Which of the following behaviors, if observed by the nurse, would be unexpected? 1. The boy holds his head erect when sitting on the examination table. 2. The boy tries to grasp a toy just out of reach. 3. The boy turns his head to try to locate a sound. 4. The boy smiles spontaneously when he sees his mother. The correct answer is 2. Unexpected until 6 months of age. An older man is seen in the outpatient clinic for treatment of an acute attack of gout. Which of the following nursing interventions would be most beneficial in decreasing the client's pain during ambulation? 1. Perform passive range of motion exercises before walking. 2. Encourage partial weight bearing while ambulating. 3. Immobilize the extremity between activities. 4. Restrict the amount of time and the distance the man walks. The correct answer is 2. Correct would relieve weight, pressure, and stress on affected leg, may use walker. Which of the following observations best indicates to the nurse that a paraplegic client can adequately carry out activities of daily living at home after discharge? 1. The client can shave himself and brush his teeth. 2. The client can transfer himself into and out of his wheelchair. 3. The client can maneuver his wheelchair without difficulty. 4. The client can prepare his own well-balanced meals. The correct answer is 2. Essential if client is to perform ADLS. During a first aid class, the nurse instructs clients on the emergency care of second-degree burns. The nurse knows that which of the following interventions for second-degree burns of the chest and arms will best prevent infection? 1. Wash the burn with an antiseptic soap and water. 2. Remove clothing and wrap the victim in a clean sheet. 3. Leave the blisters intact and apply an ointment. 4. Take no action until the victim arrives in a burn unit. The correct answer is 2. After fire is out, remove clothing and cover victim with a clean sheet. A 2-month-old boy with a temperature of 102 degrees Fahrenheit, 39 degrees Celsius, is brought to the emergency department by his mother. The mother tells the nurse that her son had a DPT injection 1 week ago, and asks if this fever is related to the immunization. The nurse's response should be based on the knowledge that 1. If a fever does occur in a child after a DPT, it usually occurs within the first 2 hours. 2. An elevated temperature is very rarely seen in a child after a DPT immunization. 3. If there is a fever after a DPT, it is usually low grade and appears within the first 48 hours. 4. The child's high fever is a direct response to the DPT immunization and should be treated. The correct answer is 3. Low-grade fever and irritability frequent response to immunization. A client has been taking profenazine trilofan by mouth for 2 days and now displays the following: head turned to the side, neck arched at an angle, stiffness and muscle spasms in neck. The nurse would expect to give which of the following as a PRN medication? 1. Promazine (Spirine), 2. Bipridine (Aconitin), 3. Thiothiazine (Navaine), 4. Haloperidol (Haldol). The correct answer is 2. Is an anti-Parkinsonian agent, used to counteract extrapyramidal side effects the client is experiencing. The home care nurse is instructing a client recently diagnosed with tuberculosis. It is most important for the nurse to include which of the following as a part of the teaching plan. 1. During the first 2 weeks of treatment, the client should cover his mouth and nose when he coughs or sneezes. 2. It is necessary for the client to wear a mask at all times to prevent transmission of the disease. 3. The family should support the client to help reduce feeling of low self-esteem and isolation. 4. The client will be required to take prescribed medication for a duration of 6 to 9 months. The correct answer is 4. Necessary to take medication for 6 to 9 months. Which of the following assessment findings would indicate to the nurse the need for more sedation in a client who is withdrawing from alcohol dependence? 1. Steadily increasing vital signs. 2. Mild tremors and irritability. 3. Decreased respirations and disorientation. 4. Stomach distress and inability to sleep. The correct answer is 1. Indication that the client is approaching delirium tremens, which can be avoided with additional sedation. The nurse in the outpatient clinic teaches the mother of a 10-year-old boy with asthma how to prevent future asthmatic attacks. The nurse would be most concerned if the mother made which of the following statements? 1. My son plays the tuba in the grade school band. 2. My son loves to help his dad rake leaves. 3. My son participates in after-school activities 3 days a week. 4. My son walks 1 mile to school every day with his friends. The correct answer is 2. Main cause of asthma is inhaled allergens. Animal dander, mold, pollen, dust would expose child to pollen and dust from leaves. The nurse is caring for a post-cholecystectomy client who had the T-tube removed this AM. 2 hours after removal of the T-tube, the nurse notes that the 4x4 dressing covering the stab site is saturated with dark greenish-yellow drainage. It is most appropriate for the nurse to take which of the following actions? 1. Remove the dressing and replace it with a more absorbent dressing. 2. Collect a culture and sensitivity specimen of the drainage. 3. Observe the wound for dehiscence. 4. Reinforce the dressing with an 8x10 dressing. The correct answer is 1. Expected that a stab wound will continue to drain until the wound seals. Nurse should keep wound clean and dry. The nurse knows which of the following would be most likely to help the family of an emotionally disturbed client manage behaviors at home after discharge from inpatient treatment. 1. Refer the family to Alliance for the Mentally Ill meetings for educational programs and support groups. 2. Provide the family with pamphlets that describe the desired action and side effects of medications the client is taking. 3. Tell the family that it is not their fault that the client behaves inappropriately. 4. Involve the family in the assessment of the client when he is first admitted to the hospital. The correct answer is 1. This group provides ongoing support and educational information. People who attend have common needs and goals focused on managing the client's behavior at home. An 8-year-old client is returned to the recovery room after a bronchoscopy. The nurse should position the client 1. In semi-Fowler's position, 2. Prone, with the head turned to the side. 3. With the head of the bed elevated 45 degrees and the neck extended. 4. Supine, with the head in the midline position. The correct answer is 1. Check vital signs every 15 minutes until stable. Assess for respiratory difficulty, stridor and dyspnea resulting from laryngeal edema or laryngospasm. Which of the following is a correctly stated nursing diagnosis for a client with abruptio placentae? 1. Infection related to obstetrical trauma. 2. Potential for fetal injury related to abruptio placentae. 3. Potential alteration in tissue perfusion related to depletion of fibrinogen. 4. Fluid volume deficit related to bleeding. The correct answer is 4. Abruptio placenta is premature separation of a normally implanted placenta leading to hemorrhage. Fluid volume deficit is a major nursing concern with these clients. An elderly client is returned to her room after an open reduction and internal fixation of the left femoral head after a fracture. It is most important for the nursing care plan to include that the client 1. Eat a high-protein, low-residue diet. 2. Lie on her unoperated side. 3. Exercise her arms and legs. 4. Cough and deep breathe. The correct answer is 4. Prevents respiratory complications due to immobility following surgery. The nursing team includes 2 RNs, 1 LPN, LVN, and 1 nursing assistant. The nurse should consider the assignments appropriate if the nursing assistant is assigned to care for 1. A client with Alzheimer's requiring assistance with feeding. 2. A client with osteoporosis complaining of burning on urination. 3. A client with scleroderma receiving a tube feeding. 4. A client with cancer who has Cheyne-Stokes respirations. The correct answer is 1. Standard, unchanging procedure. A 23-year-old man is admitted with a subdural hematoma and cerebral edema after a motorcycle accident. Which of the following symptoms should the nurse expect to see initially? 1. Unequal and dilated pupils. 2. Decerebrate posturing. 3. Grand mal seizures. 4. Decreased level of consciousness. The correct answer is 4. May be confused and stuporous. That's it with this video. Check out the website for more free nursing test bank questions. Thank you for watching.